Can hip joint deterioration cause a hip fracture? Let's dive into this important question about hip joint deterioration and its potential link to hip fractures. Hip joint deterioration often refers to conditions like osteoarthritis. Osteoarthritis is a common joint disease where the cartilage, which cushions the ends of bones, breaks down over time. This breakdown can lead to pain, stiffness, and reduced mobility, particularly in the hip and knee joints. As osteoarthritis progresses, the protective cartilage wears away, and the bones may start to rub against each other. This can change the shape and structure of the hip joint. Over time, the surrounding muscles and ligaments can weaken, reducing the overall stability of the hip. Now let's connect this to hip fractures. A hip fracture is a break in the upper part of the thigh bone, known as the femur, near where it fits into the hip socket. While osteoarthritis does not directly cause hip fractures, the changes it brings to the hip joint can increase the risk of fractures in several ways. First, as the joint deteriorates, the bones may become weaker due to reduced activity. People with severe hip osteoarthritis often move less because of pain and stiffness, leading to muscle loss and decreased bone density. This condition, known as osteoporosis, makes bones more fragile and more likely to break, even from minor falls. Second, the altered mechanics of an osteoarthritic hip can affect balance and gait, making falls more likely. Falls are the leading cause of hip fractures in older adults. If someone with advanced osteoarthritis falls, their already weakened bones are at a higher risk of breaking. Third, in rare cases, severe joint destruction from osteoarthritis can lead to a type of fracture called a pathologic fracture. This occurs when the bone breaks under normal stress because it has been weakened by disease. However, this is less common in osteoarthritis compared to other bone diseases. Most hip fractures in people with osteoarthritis result from a combination of factors. These include the effects of the disease on joint function, reduced physical activity, and the increased risk of falls. Osteoarthritis typically does not cause spontaneous fractures without some form of trauma, like a fall. Managing osteoarthritis is crucial. It involves maintaining joint mobility, strengthening muscles around the hip, and preventing falls. Regular low-impact exercise, physical therapy, and sometimes medications or surgery can help preserve function and reduce the risk of complications like fractures. For those with severe pain and disability, hip replacement surgery can restore mobility and improve quality of life. In summary, while hip joint deterioration from osteoarthritis does not directly cause hip fractures, it can contribute to conditions that increase fracture risk. These include decreased mobility, weakened bones, and a higher likelihood of falls. Preventing falls, maintaining bone health, and managing osteoarthritis symptoms are key strategies to reduce the risk of hip fractures. Always consult a healthcare professional for personalized advice, especially if you have concerns about hip pain, mobility, or fracture risk.